Welcome to the 16th episode of the Lebanese Physicians Podcast. Today, we will be discussing electives in the United States, how to apply for them, the experience that people have in them, and recommendations on what to do when you get an elective and an observership and differences between observerships, electives, and research electives. Today, we have with us Dr. Nisrene Kawa, who is a graduate of the American University of Beirut Faculty of Medicine with an MD degree. Subsequently went and did a postdoctoral fellowship at Mass General Hospital in the dermatology department over there. And now currently it's doing her master in public health in Boston. And congratulations, Nisrene, too, because next year you will be doing your preliminary year at Yale Waterbury Hospital prior to hopefully matching in dermatology the year after. And our other guest is Dr. Nasser, who I've known for a very long time since medical school. He is a nephrologist and currently practicing in Boston with Beth Israel Deaconess Medical Group. Welcome, Samer. Welcome, Nisrene, to the podcast.
Thank you.
Thank you for having us.
So I'm going to start first asking Nisrene. So Nisrene, because you are the youngest one among us by far, and you recently applied for electives and observerships in the US and ended up also doing a postdoctoral research fellowship. So can you just tell us a bit about your experience applying for observerships and electives? How easy was it? How hard was it? And what your experience with it was?
Sure. So I must start by giving a little caveat. I know that lots of things are changing nowadays, especially with people's inability to come to the States because of COVID, changes in visa status, and the upcoming change in STEP scores and how it's going to become pass-fail. So I would say that it's going to become perhaps a little bit more challenging to actually come to the US, but it also makes it even more important to come for proper electives and to make an impression, because ultimately that is basically how you're going to get your in. So much so that over here, when people go on electives, they actually call them audition rotations, because that's really what you're doing. You're auditioning for a role. Going back to my personal experience, I was interested in the field of dermatology from an early stage. So I actually had reached out to a dermatologist that I had heard of, and I asked her if I could do a rotating elective with her as early as my Med 1. Granted, I'm not saying that's the way people must do it, but it allowed me to start understanding how the field works, what clinical dermatology looked like in the US, and just to understand the scope of the field itself. Again, I'm not saying that you have to start that early on. However, what ended up happening through that elective is that I was able to make connections, I was able to make an impression, and I was later able, through that, to get my Med 3 and Med 4 electives. What ended up happening is that I think it's very important for people to know when to say yes and to take opportunities, even if you're not necessarily very sure about what you're doing. Try something new, be confident and be bold. I had the opportunity through these introductions that I made to come to MGH for a research elective. It wasn't even an elective, actually. It was just a research month. It was an unpaid experience or exposure between my third and fourth year. During that time, I led a project that my mentor really liked. He was the director of the center. What ultimately happened is that he wanted me to stay on and he offered me a job. I told him I can't because I have to go back to finish my med school, but that I will take him up on this offer and follow up in the future in case I do want to return for an elective. And that is what I did. I made sure to stay in contact. I carried out the project that we had finished and I took it back with me to Lebanon. During my third year of med school, I finished it, I submitted the results, and he recommended that I present it as a poster. So the story of what I'm trying to gather over here is that you maintain this contact and you maintain this relationship that ultimately they're keeping you in mind. What ended up happening after I submitted that, I moved on to my fourth year of medical school. And when it came time to find electives, I recognized that this was somebody who had seen my work, who knew my value, and who would be likely to support me. I contacted them again. I applied for a research elective. And through my research elective, they actually offered me a position as a research fellow. So this might not necessarily be the most traditional route, but what I'm saying is that if you make a good impression early on, it will make all the difference, and you will have people rooting for you and people supporting you.
So basically, yeah, Nasreen, I think in your case, this is like you made your connections early on, and that helped you be able to secure an elective and subsequently a research position afterwards. But I think for the most part, right, a lot of people actually at the medical schools in Lebanon apply in their end of their third year or fourth year of medical school for observerships or electives. So Dr. Nasser, can you tell us a bit, what's the difference between an observership and an elective, and why do we differentiate between both?
So the 4-week block that is done in the medical schools, that is official, offered by the medical schools in the US. And there are communications between the medical schools all over the world, even, and especially in the US, where visiting students or students from the same school where they go to do these electives, and there is a program of what is expected from you. The observerships, on the other hand, they can be sometimes unofficial, and it does not have to undergo a lot of vetting, and the student is not expected a lot to have a lot of application process that's need to be done. In an observership, unfortunately, what happens is the student, especially if he's coming from outside the program and doing it there, he does not have a lot of authority or autonomy in his work. He has to be always supervised by an attending, and he cannot even examine people on his own. He has to examine the patient always under supervision, and probably he won't be able to have access to medical records or the OMR. So it is a little bit more limited than an elective. Whereas an elective, it is more organized. It is you apply for it ahead of time, and you get an ID, and you become part of the team. Officially, you are a medical student working in that medical school that you are doing the elective at. So there is advantages of doing an elective and being more autonomous on the team than being an observer. And an observership also can be unofficial, and you can be an observership and somebody invites you over, and an attending who has a clinic somewhere and tells you you can be an observer on my clinic, and you'll be head to head with him. And he can offer you probably a recommendation letter in the end, but you will not be doing anything on your own, for example. And so that is basically the main difference. An elective will be a little bit better, but still you can still have the opportunity in an observership to leave an impression. You can see patients with supervision. You can meet people. You can ask for a letter of recommendation. So it can still be an opportunity that can be fruitful in the end for your residency application.
In my experience, and I ask you both to what's easier. In my experience or my knowledge, observerships may be easier to get than electives because it does require you to get malpractice insurance, and a lot of places don't want to deal with that, or if they want to deal with that, they will have to pay a certain sum of money to be able to do that elective. So Nisrene, in your experience, knowing also your friends in medical school, was it easy for them? Is there a way, or is there a connection between your medical school and medical schools outside of Lebanon to help with that? Number one. Number two, was it easy for them to secure electives or observerships in the US?
So that's a very good question. And I think the times have changed significantly since I graduated. There is much more communication going on. From my personal experience and the experience of my friends, there was a lot of complexity at the time for several reasons, including the fact that lots of places have special rates. So they actually charge you for coming in as an electiver. And they had specific rates in terms of how much you would be expected to pay to come. There were sometimes issues with transparency. Sometimes some of my friends would get accepted for an elective, and then they would receive an email later on saying that, they were bumped for somebody else. So at the time, they did have significant complexities and difficulties in actually securing something. At AUB, I know that the Dean's Office does make a significant effort in supporting students. So I think it's worthwhile for all students from all universities to reach out to their Dean's Office and ask if there's a list somehow of previous graduates who are now either doing research somewhere or have previously received electives somewhere, or who are residents or attending physicians at a center, because those warm connections would somehow allow more facilitation to enter, and it reduces the barrier to entry. There are a few or a handful of programs that, have a predilection for liking certain students from given universities because they know the quality of the students that are coming in. So what I would recommend is to definitely reach out to your dean's office, and even reach out to people who are a little bit older than you are and who have graduated. I know that personally, in the last couple of years, I've had several people reach out asking me if I knew of people. I obviously am not the gatekeeper, but at least I can direct them to people who would be more supportive than I am, or more capable than I am.
Yeah, so part of it is basically reaching out to some of the people you know in the United States to do this. And Samer, so once they come to the observership or the elective, I know it's hard. Like I remember my experience very, very long time ago. It's hard, like to ask, do you work with somebody as an observer for a couple of weeks, and then it's hard to ask them for a letter of recommendation, which I think is important because it's always and at least that's what we've been told. I don't know if it's true, that it's important to get a letter of recommendation from the United States to help you with the match process. So one, is it important? Number two, how do you ask for that letter?
So yes, I think it is a great opportunity. You put all this money and all this time to go to the US and do an elective there, and probably you're leaving a good impression. You have to take this opportunity and ask for a letter of recommendation. But make it a point that early on in the rotation, that's what people probably don't know about that, is that you inform the attending that you are working with.
Mm-hmm.
That you plan to do residency, for example, in the US, and that you want to earn a strong letter of recommendation. This at least makes the attending take more interest in you than he would if you ask him later on in the rotation. And usually you have to know one thing, that if you do a 4-week block, most likely you're going to work with 2 or even 4 attendings. Sometimes the attendings do 1 week on the rotation, but most of the time they do 2 weeks, for example. You're lucky if they do 4 weeks, or unlucky if you don't get along. It's the best scenario is to have 2-week blocks with an attending. So I would, from day 1 or day 2, I would make sure that to inform the attending that I would like to earn a strong letter of recommendation. And at the end of the first week, you probably want to get feedback from the attending, like, is there anything that I can do to improve? Do you think I'm doing a good job? Is there anything that you'd like me to do to be better on this rotation or to improve my skills? And that also gives you what is the expectations from the attending, and it will give you like a good feedback of what you can improve in 1 week. At the end of the rotation with the attending, probably you should tell the attending, like, thank you for teaching and all the teaching that you provided me this week. And I would appreciate any feedback, and I would like to know if it is possible that you write me a strong letter of recommendation for my residency. And if they say it without hesitation, you should use that letter for sure. Like if they tell you, yes, I would love to write you did a great job and I will do it. You can take even the risk to waive the right to see that letter and put it in your ERAS application.
Which is a good question as you're continuing. So should you waive the right to see the letter, or should you not waive the right to see the letter?
Oh, that's $1 million question. It's like the lottery. Some people, I do know that, because when I was a chief resident back in Syracuse, I attended those meetings where we chose applicants. The letters that were waived, the right to see them, took more weight on them. Okay, that doesn't mean that the other letters didn't. Mm-hmm. So yes, waiving, it shows that the attending will be writing more freely. And if you know that you did a good impression, and if you know that this attending is going to write you a good letter, yes, I would waive that right. Okay, and you could make some research, like you can ask the residents you worked with or students you worked with or the fellows actually, who have very good connections with the attendings. I'm talking in terms probably in internal medicine now, where there's fellowship. There could be also residents and surgeons. If they tell you that he writes a very good letter, You probably, I think you can take a good risk in waiving it. Some people don't want to take the risk, and they are gonna get more than 4 letters maybe, and they would like not waive the right to. They want to see the letter. I remember that I saw the letter, for example, when I applied for my residency, and it was a great letter. But it gives me reassurance that it was a good letter. And I don't know if you have a choice even, because by the time you leave, because you're not applying to the ERAS immediately. So you might do the elective and apply to the ERAS like a year later. That attending may forget who you are. So I'm not sure if it's going to stay. It's probably he probably will give you a letter that is not sealed, and you have to see it, for example.
Right. I think it's a good point to let the attending write you the letter on the spot, approximately, without a date initially. Exactly. Because I've had people before ask me for letters like 1 year after they've worked with me, and I don't even remember who they were, so I can't write a good letter for them. And before I'm going to ask Nisrene, the question now is, how was your experience asking for a letter of recommendations?
Honestly, it was a good one. I didn't find it awkward or uncomfortable at all, because I feel like having maintained good relationships with the people that I was working with and that I shadowed or that I had my electives with made me confident enough to know that they wanted what was best for me. And that's another thing that I wanted to highlight. Finding someone who thinks that you're good is always nice, but finding someone who wants to take you under their wing, who wants to be a mentor, that is really unbeatable. If you are able to find somebody who you know is vested in your success, you can without a doubt conclude that this person will go above and beyond, not only in the letter that they're going to write you, but in all the different subsequent steps that are just equally as important, by the way. I don't think that's within the scope of what we're talking about today. But when you think about matching and applications, it's not just about the strong letter. There are occasions, especially in competitive fields, where you want people to make those phone calls for you. You want somebody who's going to really push for you. And those are the people who know you well. When it was time for me to ask for letters of recommendation, I reached out and I asked other people in the field, what is the most important type of letter I'm getting? Is it from someone in my home program who knows me well? Is it someone I shadowed a while ago? Is it going to be somebody who I did research with? And they said, pick at least one person with US clinical experience, if not 2, because you get 3 or 4 letters depending on the application field and what you're going for. And make sure that at least one of them knows you very well. You don't want a generic letter. Follow up, ask early. I remember that when I asked 2 or even 3 months in advance, because most often, and this was a follow-up ask, by the way, just to go back to what Samuel was saying, I asked very early on. They knew that I was applying. Ask early, because there are going to be instances where there are delays that are unexpected, where people will forget, and where people don't want to be pushed at the last minute. So adequate follow-up is always good.
And I agree. And I'm just going to add one thing with the waive the right to see the letter. One mistake I think sometimes people do, which I don't like at all when people ask me for this, they would be like, please can you write us a letter and put on it that we waive the right to see it, and then they ask you to send them the letter to see it before you send it into ERAS. And typically I tell them, no, I'm not going to send it, but that leaves a bad taste with me.
Yeah.
That this is not a very appropriate question. So when you ask somebody to waive the right to see the letter, then you waive the right to see the letter. You don't
also, I just want to add one thing. Be very careful. If you're waiving this, you want to know that the person who's writing it actually knows you well. I have classmates who didn't waive the right, and it was actually in their benefit, because the person ended up writing the wrong name. They spelled their name completely incorrectly, and she was a female, and he wrote it as he. So it goes very badly at times if the person who's writing it for you is doing something generic and doesn't know you well.
Yeah, and a question for both of you. So Samuel, like if I think also it comes up, I've seen people do this before. So you work with someone as an observership, let's say, and then should you ask them, or how do you try to stay and work with them after you leave, like leave the connections with them, what are the best ways to try to leave the connections with these people after you leave that observership, just for them to keep knowing you and help you out later in the future?
Okay. So, for example, if somebody comes and works with me, and they usually would try to ask you if there's any research that they want to work in, and or if they are interested. The important thing is for you as an applicant, you know what you want, okay, and you have the time to do it. I mean, do not ask just for the sake of asking. The elective is probably enough time to leave an impression. But if you want to keep in contact with this person, the fact that you tell him that I want to apply here, if they take IMGs, I would be very interested in applying here. What are my chances? And if you see any kind of positive response from him, he will stay in contact with you. You can stay in contact with him. Don't forget that you are one of many. You could be like Nisrene, for example, unique person who's worked and left a very great impression, but it's not always the case. So if you have interest in this particular attending's work and research, and you're willing to put the time and research later on before you're applying for residency, I would stay in contact. Even if he does not have that, but you're interested in that field, he can put you in contact with people, and then you can start the process of contacting other people to find opportunities for yourself. And but I don't know if I answered your question correctly. Was that?
Yeah, I think so. Yeah. So Nasreen, do you agree?
I agree, and I'll add a couple of thoughts and perspectives. I think that it's very important for you to be very genuine in your approach. Don't try to sugarcoat things. Like Samer was saying, know why you're doing it, know how it's going to benefit you, and don't overpromise. Just be very genuine in your approach. If you enjoyed working with the person, you can say, I really feel like this was a wonderful experience for me. I would love to come back if you would have me, or if you have any recommendations for me, this is exactly the type of work I'm interested in doing. Just be honest and be pleasant. Unfortunately, there are certain instances where I've seen people who have a little bit too much of an ego when they approach things, making it sound like, you would be so lucky to have me. Well, that's fine. It's good to be confident, but approach whoever you're talking to with humility and make it clear that what you're looking for is mentorship and a collaborative approach. That's already a very important thing to consider. Right. Also, don't just seek research opportunities to work with people just for the sake of doing something and filling a gap. You have to understand that eventually people are going to ask you what the purpose of every single thing you did was. It's not a matter of interrogating you, but people are going to be genuinely curious about your story when it comes time to apply. So when you tell them, I worked with this person on this project, they might ask you why, what is it that interested you? Tell us a little bit more about your thought process when you were doing this. So make sure it fits well within your story. And don't just work with anyone because it's available. Consider the long run, consider the long game. Is this going to further your career? Is this going to help you get into this residency program? Are these people even going to offer you one? There are several programs where they take IMGs for research fellows, but they will not offer you an elective, or they will not offer you an interview even, or sometimes they'll offer you a courtesy interview, but it's not going to go further than that. So know where you're going to play your card and know what the value added of what you're doing is. Are you trying to get a good letter from a high reputation institution, or are you trying to actually match there? Figure out what you want, and as Samer said, when you know what you want, that is when you approach people and ask for things.
Excellent. And I think one other thing we did not discuss is also not only your relationship, I guess, with your mentor. I don't know if you both agree with me, but also your relationship with the residents, fellows, and students Definitely. With you is probably important, right?
Definitely.
Because people are going to ask them. There's a lot of 360 evaluations where people would ask them, hey, did you like this person? And if it's happened to me before, you get somebody for an observership. When I was at IU, we used to do it. You get somebody for an observership, and then I always ask the residents, the nurse practitioners with us, whether they like that person or not. I think that makes a big impression when they want to write a letter. If everybody says, oh, we love this person, that makes a big difference. Somebody says, you know what, this person, we hated them, or they were very inappropriate, or they did not click very well with the team. then you either don't get a letter or you get a very bad letter, which will reflect on you afterwards. So which brings me to the next question, which Nisrene just brought up. So should people do observerships or electives in places that subsequently offer positions for international medical graduates, or should they just do anywhere they get, even if it's a place that they know will not match them eventually?
I think it. I don't know if the question is for me, but yes, I think it is.
For both of you, yeah.
Both ways could have their pros and cons. Okay, working in a place that does not take IMGs is okay because you are getting a good experience, most likely. Usually, those are bigger programs, but not necessarily. As long as you are working with a team and the elective is really respectable and you're working with somebody known and they can give you a good letter, that would be a very good opportunity to complete that elective. And you probably won't get a chance to do that again. And you never know, they might remember you later on when you apply for fellowship because they might take IMG fellows, for example. I think it is okay to do it in a place where they do not take IMGs. In a place where they take IMGs, yes, but you may have no chance of getting there because they prefer American medical graduates over IMGs. It's still it's a good opportunity. Things change over the years. You might leave a very good impression that you might work with a program director and you might open the way for other people to do it. And so it started from somewhere. For example, some schools people from Lebanese universities, some programs like people from UB, from USG. So it is because of experience they had with electives maybe, and then with residents from those programs. So I think it doesn't matter a lot as long as you learn, first of all, get a good experience, leave a good impression, get a good letter, and also an elective is graded. So it is still part of your curriculum at home. So you need a good grade from that.
So, Nisrene, what is your experience?
I would agree with Samit, but I'd actually add a couple caveats to that. I think that, again, it depends on the long game. It depends on what you're looking for. If you're applying to a field, which we know it's not any biases, but there are some that are historically more competitive than others. Some where, an elective is not going to be sufficient for you to actually get in, thinking things like ortho or ENT. You're going to want to have repeat exposures to them. You have to think ahead of time, what is it that you're trying to get out of this? For lots of people who are applying into IM or PEDS, having exposure in the US and having good clinical exposure and a good letter, in any case, if they are a good student, they're going to receive a good number of interviews. So where they do their elective, whether or not these places are going to interview them or offer them positions, may not necessarily be very relevant. So as Samir said, as long as you're getting good experience, good exposure, you might get a good letter out of it. Doesn't matter if they're going to take you or not. If anything, having a big program, a big name program that may not consider you, but that will write you a good letter may actually be to your benefit. However, if the opposite is true, if you're going for something that you recognize as very, very competitive and that you know ahead of time that your way in will be through a fellowship, for instance, like a research fellowship, and you're going to have some interim exposure, you first need that step to actually get to them. So you may start thinking ahead of time, what are those programs where I'm more likely to make a connection with people where they will like me and be interested in offering me an interview? Because for certain positions, interviews are going to be more limited for certain fields. So I would say that if you are applying to a field that you believe you're going to be a competitive applicant, you believe that you're going to have sufficient exposure and you have good chances of matching whether it's at that program or another, then it doesn't really matter if they're going to take you or offer you a position later on. If you are going for something that is a little bit more competitive and you understand that the stacks and the likelihoods are against your favor, you might want to be a little bit more strategic about where you go.
And I'm going to ask one hard question to both of you
Sure.
right now. Let's see if you can answer it. So in these days of financial distress and collapse in Lebanon, People may not be able, because I know we used to do like 2 electives. I don't know if it's still the same in our fourth medical year at AUB, but probably in other universities too. But let's say your parents can only afford to send you for one elective or observership, and you get accepted at a program that takes IMGs, and also you get accepted in another program that is very well known but does not take IMGs. So Samer, what would your choice be? Would you go to the program that accepts IMGs or the other program?
Well, it depends also, like Nisrene said, like you have to check what your goals are. Especially like I may be biased always in regards to internal medicine or the non-surgical residencies, which are a little bit less competitive because there's more positions. So if you think that this program that would take IMGs it's a strong program, first of all. If it is strong and there is a chance that you can get there, I would take that, I would do the elective there, if you think that it is worthwhile.
So I would say, before thinking about which elective, you have to really stop and think about who you are as an applicant. It's not trying to, shame somebody for their grades or their standing or where they are. But you have to understand that ultimately, it's not just about the place, it's about you as an applicant and what your fit is like. If you think that you are an extremely competitive applicant with unbelievably high scores, and actually the scores aren't even going to be relevant soon, and you really think that you have an excellent package, that you're not going to have difficulties in accessing residency in the future, then why not go to the place where it's going to be a big name program? Ultimately, if they give you a good letter, as long as they give you a good letter, and you're going to have something to show for it, and you're going to have good clinical experience, go for it. If you really reflect and you realize that you're a modest student, that's the thing. Med school is tough, residency is tough, no judgment here. But if you really recognize that you're going to have trouble, don't push yourself and stretch yourself thin to prove something to whom, to go to a high name program where ultimately it's not going to give you a step in the door. Instead, be a friend to yourself, figure out what works for you, and go to the one where you will have a chance. And there's nothing wrong with that. Because ultimately, when you're done, you're going to be trained, you're going to be excellent, and you're going to practice. So it doesn't matter where you did that 1 month of your life when you were med for.
What would you do, Khalil?
I think it's a hard question. I would answer like Nisrene. I think it depends on what I'm applying for, and let's say if I'm applying for a very competitive specialty, I might go to a program that's very well known to get good letters from that program. If I'm applying for a not so competitive specialty, and let's say I want like a less competitive specialty like family medicine or pathology or something like that, I would go to a program potentially that could match me too. I mean, it depends, I think, on what your goals are in that case. You put me on the spot. I didn't want to answer that question. So
careful what you ask if you're not ready to answer.
And finally, I think a couple more questions here. One is, what's your advice for the students now? It's much harder with COVID to secure any observerships or electives, but students are still applying and they really want to come to the United States right now. Mm-hmm. So Nisrene first, what's your advice to the students right now, and how are they going to be able to get letters of recommendation from outside of Lebanon?
So that's a very important question and a very interesting one as well. First of all, I would recommend to start thinking of things from a glass half full rather than a glass half empty situation, because similarly to students from Lebanon or other countries not being able to be granted access to electives in the US, most US medical graduates and US medical students are also not able to do electives other than at their home institutions. So, think of it that way. You're already at equal standing. This might not be the answer that you were looking for. However, you have to start with that frame of mind and then think of other more creative ways. Things that I would recommend. There are some programs right now that are doing virtual electives. It might not be in your field of study. It might not be in the programs that you're looking for, but this is something that exists out there for several programs. Some of them are even surgical. It might give you the opportunity to have virtual grand rounds, virtual experiences and exposure, and just to be there, maybe less formally. But you know what? Think of it this way. It's also less expensive and you get to stay where you are. Another thing I would think of is finding other ways to put yourself out there. including research at your home program. If you are able to have a poster or an article or something that you can submit to a society, lots of those programs are now online. If you can put your name out there, lots of them have like Zoom meet and greets, meet people that way. Find a way. Don't look at the problem, find solutions.
Samer, what's your advice?
So yes, my advice is like everything else that happened during the past 2 years, we have to adapt. Like Nisrene said, so we have to find new opportunities, new avenues. Just be careful that the time is limited. You have to work early on this thing, like especially if you want to do those are limited opportunities, and especially if you want to do research or to make or dedicate that time that there was an elective, doing it an elective research back home, or if you want to do it with affiliation with somebody else, try to work on it very early. Ask people you know already that have done something similar, or they can take you in. And of course, you're not going to receive anything paid. You're a student, so you might be like a plus for somebody actually to do some work. So, but these things take time, and you have to write protocols. You have to write proposals for these things. So just plan ahead of time. We adapted too many things. Also, it is a good way to explore opportunities back home in your school, how you can improve your school programs, school electives. Maybe those are opportunities to help other students who are going to come after you. So it could be a benefit and like a blessing in disguise that you were able to discover something that you never knew that existed back in your medical school at home. But it's very important to be very efficient and work early on. If your elective is coming in 3 months' time or something, try to work on it as soon as possible. And many things have changed. People are busier everywhere in the world, in the States, in Lebanon. And so you just have to be very time efficient in these things.
Right. And which brings me to the last question of the day is a lot of people are asking this question right now. They're finishing medical school, and then it comes to their mind, should we come and do research, 1 year of research in the US, or should we stay in our institution or some other institution in our home country and do a 1 year of internship over there, let's say? What is the best option, Samer? And don't ask me to answer this question.
No, I won't. Okay. So the best option, again, I'm going to repeat what Nisrene was saying earlier, is who are you and what do you want to be in the future, and what is your goal? What do you think is going to work better for you? The Lebanese medical graduating students tend to follow trends. They, at some point, internship was the best thing to get back in our day. Like 5 years later, a research opportunity for 1 year. It was something that everybody wanted. But then again, is it going to help you later on in what you're going to do? Do you know what you want to do? Like, for example, if you're going to apply for internal medicine residency, and actually an internship would be a very great experience at any medical school now in Lebanon because of everything that's going on. And that will give you a year of experience, and you had an internship as almost like a first-year resident or second-year resident. So that is something to think about. On the other hand, if like the competitive residencies like surgery or ENT or those subspecialty in surgeries, even medical students in the US tend to do research for a while. For a year, or even 2 years, even before they apply for residency, in order to be competitive enough that they are going to be in an academic program that is going to give them tenure later on. And so it's really it takes a lot of planning. So now, how easy is it to get even the research? It's not also there's not a lot of opportunities out there, especially in this time. With the COVID, a lot of things got canceled. Many programs have canceled their grants and they're not taking any research assistance. So it has become even more difficult, but many students have been able to get it. So maybe they applied ahead of time. The visa situation, I'm not aware of, but it's still, from what I learned from the trainees group, that people are still getting visas, work visas, or for the research. So it's not really a very complicated endeavor.
Yeah, I think what we're talking about too is paid versus unpaid research, because a lot of people want paid research positions, which are even rarer. And probably you need to have a CV that shows that you've done some form of research and you are of benefit to the person you're going to be working with for them to pay you for the research. So that's something maybe you need to work on to beef up your CV. So what do you think, Nisrene, research or an year in Lebanon? I know what you did yourself, but...
Yeah, so this is a whole conversation in and of itself. So I will try not to dive into too much detail, maybe for another time. But what I will say is that there are pros and cons to both. As Samir said, there are certain instances where one is better than the other. You have to have a couple things in mind. First of all, you have to think of your timeline. Second of all, you have to think about optics. I know some people from my year who had spoken to their mentors over here. They had decided to go for research electives and they were applying directly. Their mentors over here told them, I'm glad that you're in the US, because when I'm thinking of people that I'm going to hire to come here, I want people who are not going to have trouble adjusting. You are telling me that you are currently doing a program in your home country. What makes me so sure that you are going to come to the US, not have visa issues, be able to adapt properly, and that you've had proper and adequate experience and exposure to the US system, that I can confidently say you're going to be fine? People don't want to have to hold your hand when you get here. The opposite might also be true. They might think, this is somebody who is worth their weight. They have done their intern year. They're already well seasoned. So there isn't a cookie cutter response to this. It's highly variable. In addition to that, if you're thinking about your timeline, are you applying as an intern? Are you going to have adequate amount of time as an intern to either do Zoom interviews if they remain virtual, or to travel to the US to do your interviews during that time? What is the added advantage of each of your options, and where are you going to shine more? And in terms of research, I know that this wasn't specifically your question, but you were specifying a year of research. Depending on the kind of research you're doing, the field of study that you're in, whether it's bench work or clinical work, a year might be fine. A year might be not nearly enough. And if anything, it can even look bad, because if you're going to come and you're not going to get any publications, you're not going to get any exposure, and you're just basically coasting, it may look bad, because then you have nothing to really show for it. So it might ultimately be better for you to do an intern year where you're sturdy and stable and you have something to show for it. If, on the other hand, the research elective or the research position that you're taking is guaranteeing you significant exposure, mentorship, somebody who can vouch for you, that's a whole different situation. So again, there is not a cookie cutter answer to this. I wish it was easier that I could tell you, this is a one size fits all, but it isn't. There was something else I had in mind, but it slipped. If I think of it, I will let you know.
Right, great. And yeah, I'm just gonna end it with one more thing too, just an example. I know we've heard Nisrene's example of success, I think, in the way she did things to come over here and get her positions, and hopefully she will be successful in getting her dermatology position, which is even everybody knows that dermatology is very hard to get into, but I think she's good enough that she will be able to do it. I'm pretty sure about that.
We'll see.
So you'll tell us in next year, maybe we'll update people.
No pressure.
No pressure. But I think I can give examples. When I was at LAU and we worked with Indiana University to send students and residents to do a specific elective in the ICU there. I mean, I think it's important. Like when the first student went, he made a very good impression. And so they were open to getting others to come in. So when you go there and you make a good impression, you don't only help yourself, you also help your other colleagues to come and do the elective there. And I think the other piece of success that I saw was that several of them were able to continue their connections, continue to do research, write book chapters with them. And even one of them was invited to moderate the session. And American Delirium Society. So I think if you keep your connections, you leave a good impression, then that will open a lot of avenues for you. Any final pieces of advice from you both to the students who are applying?
Work hard and be authentic. People will see right through you if you're doing it for the wrong reasons, or if you don't know what you want, or if you're trying to weasel your way through. So work hard, be authentic.
Samer.
Yeah, keeping it in the electives. All medical students know what hard work is, and make sure that when you're doing an elective, that you're paying a lot of money, you're doing it in a very short period of time. Put a lot of effort in it. The word elective can be deceiving sometimes. It's like a free time for some people, but it's not for you if you're paying all that money and doing all this effort. Take the opportunity to prove who you are, or take the extra mile and work harder even, just to leave a good impression for yourself, for your resume, for your and for others, like Khalil said, for the future.
I think if we want to summarize everything we talked about today, it would be start early, make your connections early, ask people you know to help you out, because they might know people who will help you out to get an observership and elective. Ask your dean's office at the medical school, because they might have already established connections that could be helpful to you. And then once you come to the elective, make sure you work hard, make sure you work well with everyone, and make sure you ask for your letter of recommendation in the right way, and don't be too pushy when you're doing that. So thanks to you both. This was a great discussion. I hope it will be helpful for everybody who's applying in the coming year or two to come here to the US and pursue the training positions that they want to get into. Thank you very much, Nisrene, and thank you very much, Samer.
Thank you very much, Khalil, for doing this. Thank you.
Thanks.
Thank you.